Good afternoon, and thank you for joining us today. I'm Dr. Elena Fazio, a program director in the Division of Behavioral and Social Research here at the National Institute on Aging, or NIA, which is part of the National Institutes of Health. I will be hosting today's Facebook Live Q&A on social isolation and loneliness. It is my great pleasure to introduce Dr. Janine Simmons, who will be answering your questions today. Dr. Simmons is trained as a psychiatrist and neuroscientist and is the chief of the Individual Behavioral Processes Branch in the Division of Behavioral and Social Research here at NIA. Dr. Simmons?
Thanks, Elena. I'm excited to have this opportunity to connect with you and with our audience today on behalf of NIA. At NIA, we support and conduct research on extending the healthy, active years of life. And NIA researchers have learned a tremendous amount about social isolation and loneliness, about how these conditions impact our health as we all age, and about how all of us can take steps to be more connected.
To the audience, if you have a question you would like to ask Dr. Simmons, please go to facebook.com/NIH Aging or use hashtag #CommitToConnect on Twitter. We will also be sharing resources and links on our Facebook page throughout today's discussion, so please follow along with us there to find that information. One last thing before we get started, we want to be clear that the information given or discussed today is not medical advice. We are sharing insights from the latest research, as well as resources on this topic. If you need medical advice, please do speak to a healthcare provider. This is a quick 30-minute Q&A, and we received a number of questions in advance, so let's dive in. Let's start then with the basics. What are social isolation and loneliness?
Right. It's important to note that social isolation and loneliness are not actually the same thing. So social isolation is the objective physical separation that you have from other people, for example, when you live alone. Loneliness, on the other hand, is the subjective feeling, the subjective distressed feeling of being alone or separated. So your risk for loneliness increases when you're socially isolated, but different people prefer different amounts of alone time. So you can certainly be alone without feeling lonely. And I think as we've all experienced, it's possible to feel lonely even when you're surrounded by a lot of other people.
Well, so many of us have been isolated or had feelings of loneliness, especially over this past year, due to the COVID-19 pandemic. Why is this an important conversation to have right now?
It's an important conversation to have right now because the COVID-19 pandemic has made us all rather forcefully aware of the issues of social isolation and loneliness. That said, many Americans have felt socially isolated and lonely before the pandemic, and we have 20 years of excellent research to help us understand the health consequences of isolation and loneliness. So two quick examples from that research emphasize the important effect that these issues have on our society. Research studies have found that 1 in 4 adults aged 65 or older is socially isolated, and around 43% of adults aged 60 or older have reported feeling lonely. So this is an important conversation to have for a few key reasons. First, it's likely that you or someone you know is experiencing either social isolation or loneliness or both. And second, we are learning from the research that feeling isolated and lonely for long periods of time can seriously impact your health. Finally, and perhaps most importantly, there are steps you can take to feel more socially connected and to have better long-term health.
Thank you so much, Dr. Simmons. Let's talk about the impact on health a little bit more. What are the health risks of feeling isolated or lonely?
Yeah, so it's normal to be separated from people or feel lonely once in a while. We all do. But when people have these feelings for long periods of time, it can negatively impact their health. And research has linked social isolation and loneliness to the higher risks for a variety of physical, mental conditions, including high blood pressure, heart disease, obesity, a weakened immune system, and mood and anxiety disorders. Social isolation and loneliness may also be bad for your cognitive health, your ability to think and learn and remember. And chronic loneliness and social isolation have been linked to poorer cognitive function and higher risk for dementias like Alzheimer's disease. Finally, social isolation and loneliness can also increase the risk for earlier death.
So then, what does the research tell us about how feeling lonely or isolated can lead to changes in the body?
Yeah, so Elena, feeling connected to another person or people is a basic human need, like the need for food. So we need connections to other people to survive and thrive. And people who are lonely can actually experience emotional pain in the same way that people who are starving experience deep hunger. So we can think of positive social relationships as protection against the negative feelings and as buffers that normally help us cope with the stressors of everyday living. And because these social protections are so important, if you lose your sense of connection or sense of community, it actually turns on biological defense mechanisms in your body. In fact, the same biological defense mechanisms that your body normally uses to fight off infection. And you need these responses to help our bodies prevent or recover from infections and to respond properly to threats. But when the responses last too long, it can increase the risk of chronic diseases like the ones I talked about before. It's complex, of course, and it isn't just a one-way street. So studies also show that your health can impact whether you become socially isolated or feel lonely. We're still learning more about the mechanisms or pathways that lead from being socially isolated or feeling lonely to these negative health outcomes that I've talked about. And NIA continues to support critical research in these areas.
You mentioned risk. Who is most at risk for loneliness and its negative impact on their health?
Well, anyone can be at risk, but people who are at higher risk for loneliness include those who have been unexpectedly separated from friends or family through events such as illness or death of a spouse or partner, those going through significant life changes such as retirement or divorce. And as we age, sometimes we're at risk for social isolation and loneliness because we have increasing loss of mobility, worsening vision, hearing problems, or an inability to access transportation so that we can't get around in our environment anymore. Caregivers of people living with dementia or other illnesses may also be at increased risk for social isolation and loneliness. So if you are a caregiver, NIA has resources, especially to support you on our NIA website. And you can also find links to those resources on NIA's Twitter feed and Facebook page.
Thank you, Dr. Simmons. What steps can our listeners take to help protect themselves or someone they love from the effects of loneliness and social isolation?
Right, I think this is the most important thing maybe we're going to talk about today, because there are many ways that people can find connection and reduce feelings of loneliness and isolation. So first, I just want to say that it's important and worth putting the energy in to stay connected to those who are already in your life. So schedule time each day to get in touch with family or friends or neighbors. You can stand on your porch and yell across the street to talk to them in person, contact them by email, by social media, or just good old-fashioned phone call. You could host a virtual dinner party. You can send cards or letters just to keep up old friendships, which have been so important. And I guess I would say that you want to remember not only to check in on people's health and their concerns, but also just to keep doing the things you've always enjoyed together and just to laugh. Now, because we have had all to find ways of adapting to the COVID-19 pandemic, there are an ever-increasing number of online activities that can also allow you to connect with others and keep you safe at the same time. So, for example, you can find online classes for cooking or crafts, and many faith-based organizations offer streaming services, online study groups, special events where you can engage with others and deepen your spirituality. The increase in online activities, in some ways, is actually a bit of a silver lining, Elena, because some of these things might be things you always wanted to try or to participate in more often, but you weren't able to before. So, for example, I've been able to move from my once a week in-person yoga class to joining remote classes 2 to 3 times a week, which reminds me to encourage everyone to stay as physically active as possible. Walking or hiking outside with a friend has combined benefits for your health. As the weather gets better, I'm also thinking about volunteer activities outdoors that still allow you to maintain physical distance from others, like community gardening or cleaning up local parks. And of course, animals are always a great source of comfort. Having a pet may lower stress and blood pressure. Now, that's a long list, and if you're feeling lonely and disconnected, these suggestions may be easier said than done. So to keep yourself from being overwhelmed, I recommend trying to pick just one thing every day that you would both enjoy doing and that seems doable right now. One person to call, one birthday card to send, one visit to a virtual book club or exercise class. If you need additional resources and programs can be found through your local social service agencies, community and senior centers, public libraries. Also, I wanted to introduce our audience to the Administration for Community Living, which has an elder care locator on its website. And that elder care locator is designed to connect older adults and families to services in your local community. That website link is www.acl.gov/commit-to-connect. I also encourage you to go to NIA's website to find more resources and recommendations for getting connected.
Thank you so much. I find the comment you made about picking one thing to be particularly helpful. So thank you for that and the other resources. Another question for you. When should someone talk to a doctor about social isolation or loneliness?
It is important to talk to a health professional if you or a loved one is feeling isolated or lonely most of the time. Let your doctor know about any major changes or stresses in your life, such as a divorce, the death of a loved one, or having to give up your favorite activity. A doctor who knows about your losses and stresses will be better able to understand you, how you're feeling, will be better able to recommend specific resources in your community, and will be better able to discuss with you how to maintain and improve your health. And nowadays with COVID-19, I know it's sometimes difficult to get into the office and see a doctor, but the telehealth doctor visit options have been vastly expanded. So hopefully this is something easy for people to access.
Thank you so much, Janine. I'd like to actually pause for just a minute so our interpreter team can switch out. So let's give them a second to switch. Thank you so much, April, and hopefully we can switch to our next interpreter. Wonderful. Okay, it looks like we're ready to go again. Let's return to some of our questions. So, Dr. Simmons, what can someone do if they are feeling lonely as a result of grief, mourning, or even depression?
It's normal to mourn when you have a loss. And we've all had losses lately. But I want people to know that later life does not have to be a time of ongoing sadness or disconnection. If you're going through grief or mourning, family and caring friends often can provide great support for you. But there are also grief support groups that can be very helpful, perhaps especially now during the pandemic when so many of us are going through so much loss. Also, as I said before, remember to take care of yourself. So try to eat well, exercise, get enough sleep, and get back to doing or finding new activities that you enjoy little by little. Grief and mourning should pass after some period of time, and you should feel not that you don't think about your loved one anymore or you don't miss them, but that you're able to get some pleasure from things in your life. Depression is a common problem among older adults, but it is not a normal part of aging either. It is also treatable. So it's important to let a health professional, a doctor, or a therapist know about your feelings and ask about treatment. For example, if you feel sad all the time, are unable to imagine life moving forward without your loved one, experience a general loss of interest in the things you used to like to do, or if your sense of loss is keeping you from doing even your most basic daily activities, please let your doctor know. And tell your doctor or other health professional about symptoms such as lack of energy, poor appetite, trouble sleeping, or little interest in life. These could be signs of complicated grief or depression, and both of these can be treated. In some cases, people with a major depressive disorder can feel that life is no longer worth living. And I want to provide a bit of information about how to handle those types of situations. If you are having thoughts of harming or killing yourself, please call your doctor's office, 911 for emergency services, or the National Suicide Prevention Lifeline at 1-800-273-8255, which is 1-800-273-TALK. And there you can connect with a trained counselor 7 days a week, 24 hours a day. And if you have concerns about someone else, I want to make sure that people know that it is important to ask someone you're concerned about if they have thought about wanting to die or trying to kill themselves. I know that this can feel very uncomfortable, but research suggests that acknowledging and talking about suicide can reduce suicidal thoughts in others. In a crisis, please do not leave your loved one alone. Try to get them to seek help immediately from an emergency room, physician, or mental health professional. Because suicide can be prevented, you can make a difference. Thank you.
Dr. Simmons, thank you so much for that incredible set of information, a very important set of topics for sure. Another question for you, has the COVID-19 pandemic increased feelings of loneliness and social isolation?
Well, as I said before, loneliness and social isolation have affected Americans of all ages, even before the COVID-19 pandemic. However, it's clear that the pandemic has disrupted many of our usual forms of social connection. But not everyone is feeling lonely. But it's also true that people who previously weren't feeling socially isolated may find themselves so as they face challenges maintaining important connections while maintaining physical distance. And the current situation is especially challenging for older adults who are at greater risk for the adverse health outcomes from COVID-19. Right now, we don't actually have enough evidence to clearly say how the pandemic has affected feelings overall, or whether feelings of loneliness and social isolation will persist into the future as the pandemic gets under control. Researchers are actively exploring this issue, and NIA is supporting a number of studies designed to answer exactly these questions.
You've talked about both social isolation and loneliness. Which is worse for one's health, social isolation or loneliness?
It's another important question, and researchers are definitely exploring this one. What we have so far are evidence from 5 large population-based studies that were conducted outside of the United States. These studies examined both social isolation and loneliness together, and they confirmed that both social isolation and loneliness impact your risk for early death. But how this happens seems to be quite complex, because several factors like genes or socioeconomic status may impact how likely you are to experience the negative health impacts of social isolation or loneliness. And researchers in one NIA-funded study are trying to look directly at this and identify potential interactions between genes and the environment of older adults affected by social isolation and loneliness. What we know right now is that it looks like social isolation itself is a stronger predictor of mortality, but the National Academy of Sciences has recommended more work on this question. So NIA is supporting research to learn more about how social isolation and loneliness work, other factors that may influence risk, and the most effective approaches for addressing these issues.
Can you tell us even more about the research NIA is doing on social isolation and loneliness?
NIA believes that combating this public health problem and lowering the prevalence of isolation and loneliness will require a multi-pronged approach. So there's a lot of things we're doing. We're supporting a number of different types of research efforts. For example, in the fall of 2019, prior to COVID, NIA and partners across NIH issued a call for new research on how social connectedness and social isolation are related to health. And of course, this topic has only become more relevant, and those projects are ongoing. NIA-supported researchers are also trying to develop behavioral interventions to combat loneliness and social isolation. And this January, NIA released a notice calling for more research focused on improving our understanding of the behavioral, social, and economic effects of the pandemic. This new notice encourages research on how physical distancing requirements and the associated social isolation and perhaps loneliness impact the health and well-being of midlife and older adults. It also focuses on exploring which types of strategies have been more or less successful at reducing social isolation and loneliness among older adults.
Great. Dr. Simmons, now we're going to see if we have questions from our audience for you. Here's one already. Is there information or studies on how to recover one's social health after a long-term period of isolation? I'll read that again for you. Is there information or studies on how to recover one's social health after a long-term period of isolation?
I actually think that this is not a very well-studied question, because we haven't previously found ourselves in this situation where so many people have been so socially isolated or have reduced social contact for such a long period of time. And NIH is sponsoring a lot of very active research in this area to look at the time course of how the pandemic through social isolation or loneliness is impacting health across all ages. And unfortunately, we're going to have to wait for some of the outcomes of those studies. And what we're trying to do right now is to put into practice what we know works from slightly less long periods of social isolation and loneliness, such as some of the examples and suggestions that they made before. I will note that if you want to learn more information about social isolation and loneliness or keep up with the latest research, that's always available on the NIA website. And NIA has several materials both about the research and about the clinical conditions available online.
I have a question coming up about technology. Can technology help reduce feelings of loneliness and social isolation among older adults?
Yeah, technology does seem like a promising way, and as you probably noted, I have referred to a lot of websites and online classes here today, but it's clearly not a one-size-fits-all approach. I think there's some evidence that people of different ages benefit differently from in-person or even phone call type outreach than from video, virtual, technology-based outreach. And so this is another area where we need more research to understand which types of technology are most effective for which types of individuals.
And Dr. Simmons, just to dovetail on your point there, we had a question about Zoom specifically, and whether it can combat social isolation in older adults. And based on what you just said and what I know of, that's a work in progress, right? We don't actually have research findings yet that can tell us what Zoom can do for us in terms of reducing those feelings of social isolation and loneliness. But of course, as you mentioned, NIA is interested in research that might answer questions such as that. But on a related point, how do we make sure technology research doesn't become outdated by the time results are published?
Well, that's a really good question. So I'm not sure I know the answer. I think technology does move very quickly. And what we'd like to do at NIA when we're thinking about interventions, so if we think about communicating through remote technology as a kind of way to intervene and prevent people from being socially isolated or feeling lonely, what we want to know is, well, what is it about the particular type of contact you're having that makes a difference? And so what NIA tries to do through our Science of Behavior Change initiative is actually to encourage research that specifically looks at, if you do something that you're trying to help somebody with, and it works, what were the particular elements that made it work? So I think that if we can figure out which elements in the technology are most positive and which might be actually negative, then no matter what kinds of platforms are available, we could adapt those platforms to incorporate the positive features and leave out the negative features.
You know, there's a question that has come up that I want to read to you that's about actually young adult caregivers. Specifically, What can friends and family of younger caregivers do to improve their social support and their care work? Any thoughts on that?
Well, as I said before, caregivers, especially of people with dementia, but also of people with other illnesses, are particularly affected by social isolation and loneliness in general before the pandemic and currently. And so it is important, if you know someone who's a caregiver, to reach out to them. And NIA does have resources on its website specifically for caregivers. And NIA is also funding a lot of research on how to help caregivers. I think that the the simplest things are often the best things. So sometimes if you can't help with the caring of the person with the illness, you can still help the younger person with something they need to get done. Like maybe they just need some groceries purchased, or maybe they just need their carpet vacuumed. Any small thing, I think, that demonstrates that you're thinking about them, you care about them, and you want to help them, I think can go a long way to make a difference and make them feel more socially connected.
Um, Another question we've gotten is there research about phone call programs to help people who combat social isolation? Are you aware of any of that research?
There are some studies going on right now. Um, I know of one in Texas. I'm not sure if it was a phone call study where they were looking at, but they used the Meals for Wheels program and built on that to not just bring meals, but also particularly check on individuals in terms of their social isolation. And so I think that there are also programs like that going on related to phone calls. And there is some evidence that in older people, phone calls actually can be more effective than video calls. I don't think we know why that is the case, if it's just something people feel more comfortable with. But ideally, maybe one would ask, like, how would you best like to talk to me? What would you best like to get from me? I mean, maybe I keep thinking, well, I think maybe we should just go back to plain old mail because that's more fun.
Yeah. Here's a one more question that has to do with COVID-19. What if a person who has been staying in their home due to COVID-19 becomes afraid to go back out into the community? What can they do to regain confidence to begin returning to society?
So I think that depends a little bit on what a person is afraid of. So I can imagine at least two different major concerns that someone might have. So one is the concern about being infected with COVID, which many of us have and is keeping many of us inside. I think the best way to deal with that is really to follow the CDC guidelines on remaining masked, staying far away from people, washing your hands, and so on. If the fear, however, is more like what we call an agoraphobia, so that you spend so much time in your home that when you go out, you actually just feel afraid of being outside, that it seems overwhelming or that there are too many people around. The best thing to do for that is to work little by little. So people can often help themselves with this problem, where you just take a plan that's like, today I'm going to go out on my step and see how I feel. I'm going to feel anxious. Wait till that anxiety goes down, go back inside. And then the next day, go a little further, wait for the anxiety to pass, go back, and so on, a little further every time. It's very important for this, what's called response prevention therapy to work, for you to know that you feel anxious, but wait for that anxiety to pass, because that's the important piece, to teach your body to prevent your body from being anxious or having a panic attack.
So helpful. We're going to end on our last question, Dr. Simmons, about resources. Are there any NIA resources that can help support people experiencing, of course, social isolation or loneliness that you can share with us?
Right. So that's a great thing to end with. If you want to learn more or share what you've learned NIA has a lot of materials available, and I want to note that NIA's website has health information about this topic in both Spanish and English. We've also released, for those who don't like technology or would like a hard copy to hold on to, we've released an easy-to-read booklet on social isolation and loneliness, and you can order a free print copy of the booklet for yourself, a loved one, or your organization. You can always contact NIA's Information Center directly, and we can help you find resources. If you go online, we're at www.nia.nih.gov/contact. You can email us at niaic@nia.nih.gov, or you can always call 1-800-222-2225. Finally, I wanted to remind folks about the Administration for Community Living and their Commit to Connect program, where they have ACL's elder care locator, which I talked about before, that's designed to connect older adults and their families to services in their community. That website is www.acl.gov/commit to connect. And you can find links to all these resources on NIA's Facebook and Twitter pages.
Well, thank you so much, Dr. Simmons, and everybody who made today's event possible, particularly all of you in our audience. We really appreciate your time and attention to this really, truly most important topic. For more information on both topics of social isolation and loneliness, as Dr. Simmons said, please visit the NIA website or ACL's Commit to Connect website. And of course, as always, stay in touch with the National Institute on Aging. Follow us on Facebook, Twitter, and sign up for our email lists on the NIA website. Thank you, everybody, and be well.